Hello and welcome to my channel. In this lecture we'll continue our discussion of the spinal cord descending tracts, the motor system. So let's begin. The descending tracts of the spinal cord are involved in the control of voluntary movements and postural movements and coordination of the head and neck and the eye movements. It originates from the cerebral cortex at the primary motor area or motor area 4 and the brainstem, and are influenced by the sensory input and feedback circuitry from the cerebellum and the basal ganglia. They control, they modify the commands descending from the primary motor cortex. They are comprised of the lateral and medial motor systems. So expect one for the muscles of the limbs and the other for the axial muscles that control posture of the body. The lateral motor system include lateral corticospinal and Rubrus Spinal Tract. See, it originates from the primary motor cortex here and descend through the brain stem. Now it controls the movement of the upper limb and lower limb. The cell bodies are in the primary motor cortex, motor area 4, or this is the upper motor neuron lesion. The upper motor neuron of the mechanism. Then the axons go through the corona radiata of the internal capsule. Remember, we talked about the internal capsule earlier, and they descend in the posterior limb of the internal capsule to the crus cerebri of the midbrain, where they occupy the middle region, and the corticobulbar tracts are around them. Then they go through the pons and become dispersed because of the pontine nuclei. We saw that in horizontal sections of the pons, and descend to the medulla oblongata, where they form the pyramid on each side. Now remember the decussation I showed you before on the specimen. They decussate to the opposite side through the pyramid, through the pyramidal decussation, and descend in the lateral funiculus of the spinal cord, as you can see here. This is what happened to majority of fibers, but few fibers remain ipsilateral to form the anterior corticospinal tract in the medial system. So this is the lateral corticospinal in the lateral system. Few of it, of its fibers, form the anterior corticospinal, which is part of the medial system. Axons then descend in the spinal cord, synapsing on the lateral group of cells of the anterior horn cells. Remember, this group was responsible for the movement of the upper and lower limbs. And axons of lower motor neurons exit through the anterior root of the spinal nerve formed from the spinal cord. This is the origin and course of the lateral corticospinal tract. Another tract related to it, which is the Rubrus Spinal, from its name it originates in the red nucleus of the midbrain. Then it crosses to the opposite side in the ventral tegmental decussation. We saw that at the sections, horizontal sections of the midbrain, and descend in the brainstem and lateral column of spinal cord's white matter. Now axons only descend to cervical regions, the Rubrus Spinal of the spinal cord. They synapse on interneurons in the anterior horn gray matter to control the axial muscles of the neck and the upper back. They facilitate the flexor muscle activity and inhibit the extensor muscle activity of the upper limb. This is the Rubrus Spinal Tract and where it descends in the spinal cord. It's adjacent to the Lateral Corticospinal Tract. Now the medial motor system, it's for control of the truncal or axial muscles that involved in maintaining posture and balance, automatic gait related movements, and orienting movements of the head and neck with what we see, for example. They project bilaterally and interneurons within the spinal cord on interneurons within the spinal cord and are made up of 4 tracts, the medial motor system. The anterior corticospinal is the first one, the one you see here. This is the anterior corticospinal. It's some of the few fibers forming the corticospinal tract remain uncrossed, remember. They do not decussate in the pyramid and descend ipsilaterally in the medial aspect of the anterior part of the spinal cord to the level of the upper thoracic region. Axons synapse on lower motor neurons in the medial portion of the anterior horn of the gray matter, and axons of these cells exit through the anterior root of the spinal nerve formed or emerging from that particular segment of the spinal cord. This is the anterior corticospinal, the first of the medial motor system. Now we have the Tactile Spinal C coming from the pretactile nucleus of the superior colliculus. In the superior colliculus, cell bodies in the superior colliculus of the tectum of the midbrain, they form the tract, and axons decussate in the dorsal tegmental decussation, as you can see here, to form the tectospinal tract, which descends along the brain stem, midline of the brain stem. Then it descends near the MLF in position into the cervical region of the spinal cord near the anterior median fissure of the spinal cord. Axons project bilaterally on the interneurons of the anterior horn cells, and they modulate the postural reflexes or reflex movements in response to visual stimuli. The superior colliculus is part of the visual pathway, as you should know by now. The superior colliculus is part of the visual pathway, and the inferior colliculus is part of the auditory pathway. Now the third tract of the medial system is the Vestibulospinal Tract. They arise from the vestibular nuclei in the pons and medulla. We have medial, lateral, superior, and inferior vestibular nuclei. The medial vestibulospinal tract arises from the medial vestibular nucleus, as well as that of the MLF, and I told you before, the medial longitudinal fasciculus connects the cranial nerve nuclei together. It projects bilaterally to thoracic regions of the spinal cord, while the lateral vestibulospinal tract arises from the lateral vestibular nucleus and descends ipsilaterally through the entire length of the spinal cord and synapse on the interneurons of the anterior horn of gray matter. This is the lateral vestibulospinal tract, and this is the medial vestibulospinal tract. Extension of the upper and or the lower limbs to prevent oneself from falling forwards. This is an example of how this system works. The vestibular nuclei, by the way, they facilitate the activity of extensor anti-gravity muscles and inhibit the activity of flexor muscles. So they help the body to maintain an upright posture or upright position. Because vestibular nuclei, they receive input from the inner ear, the utricle and saccule to be precise, and the cerebellum to correct the position of the body. This is the vestibulospinal tract. Now the last one is the reticulospinal. It arises from the reticular formation of the pons and medulla. Remember the reticular formation nuclei we studied in the pons and medulla. And the axons descend ipsilateral through the length of the spinal cord, synapse on the anterior horn gray matter cells, and regulate voluntary movements in reflex activity and autonomic outflow. These are the 4 tracts of the medial motor system. Vascular supply of the spinal cord. Remember the vertebral arteries, after emerging from their vertebrae and get above the atlas and enter the foramen magnum into the cranium, they give rise to the anterior spinal arteries. Two anterior spinal arteries that merge into one, and 2 posterior spinal arteries that remain 2 in number. The posterior spinal arteries originate from the vertebral artery or the posterior inferior cerebellar artery. Remember, that was a branch from the basilar or the vertebral, and descend along the length of the spinal cord in the posterolateral sulcus. Remember the sulcus between the gracile and cuneate tracts at the dorsum of the spinal cord. While the anterior spinal artery, it's formed by the union of 2 branches of the vertebral artery, as mentioned before, and descend along the anterior median fissure of the spinal cord. Now there are other branches that enter through the intervertebral foramina with the spinal nerves opposite the direction of the spinal nerves. These are called the radicular arteries, spinal branches from vessels outside the vertebral column. Now 8 to 10 segmental medullary arteries enforce the supply of the spinal cord. Largest of these arteries is the artery of Adamkiewicz. It's in the lower thoracic and upper lumbar region, typically on the left side, and it has a major contribution to the supply of the lower portion of the spinal cord. The venous drainage of the spinal cord through a series of longitudinal channels, interconnecting channels that connect with anterior and posterior spinal veins on the surface of the cord. Okay, and from there they connect to the internal and external vertebral venous plexuses and through the foramen magnum as well. That was the supply of the spinal cord. Some of the lesions of the spinal cord, for example, sensory ataxia, it's due to damage of gracile and cuneate tracts. This will terminate the information coming, proprioception information and fine touch information coming from the body, so the body won't be able to coordinate the movements. There will be loss of position of the limb, loss of vibration, loss of stereognosis. Astereognosis is an inability to recognize object in hand, and loss of 2-point discrimination. There will be positive Romberg sign, that is swaying of the body increases when standing, feet closed and closed eyes. If you do this test in a patient with cerebellar ataxia, it will not be corrected by opening eye, and there will be staggering gait because of loss of coordination. Another lesion is the syringomyelia. It's a widening affects the central canal of the spinal cord. it becomes soft, the soft spinal cord, and this interrupts the fibers crossing either anterior or posterior, like the anterolateral spinothalamic, for example. This will lead to this will occur in cervical and upper thoracic regions, leading to jacket-shaped loss of pain and temperature, which is characteristic in this lesion. Jacket-shaped loss of pain and temperature, I mean in both upper limbs and thorax. Lesions of the roots, there will be radicular pain or pain along the posterior root, maybe paresthesia, abnormal sensations, tingling and numbness, hyperesthesia, exaggerated sensations, exaggerated touch. Posterior root dysfunction produces anesthesia, and anterior root dysfunction produces flaccid paralysis of the lower motor neuron lesion type. By the way, in some cancer patients, they perform the anterolateral chordectomy. I mean, they incise the anterolateral spinothalamic tract to help the patients cope with the pain. Okay, that was one of the procedures. Well, I hope you got the maximum benefit from this lecture, and thank you very much for watching.